Signs of colon cancer. Colorectal cancer, CRC, also known as bowel cancer, colon cancer, or rectal cancer, is the development of cancer from the colon or rectum, parts of the large intestine. Signs and symptoms may include blood in the stool, a change in bowel movements, weight loss, and fatigue. Most colorectal cancers are due to old age and lifestyle factors, with only a small number of cases due to underlying genetic disorders. Risk factors include diet, obesity, smoking, and lack of physical activity. Dietary factors that increase the risk include red meat, processed meat, and alcohol. Another risk factor is inflammatory bowel disease, which includes Crohn's disease and ulcerative colitis. Some of the inherited genetic disorders that can cause colorectal cancer include familial adenomatous polyposis and hereditary non-polyposis colon cancer. However, these represent less than 5% of cases. It typically starts as a benign tumor, often in the form of a polyp, which over time becomes cancerous. Signs and symptoms of colon cancer. Colorectal polyps and colorectal cancer don't always cause symptoms, especially at first. Someone could have polyps or colorectal cancer and not know it. This is why getting screened regularly for colorectal cancer is so important. If you have symptoms, they may include a change in bowel habits, blood in or on your stool for bowel movement, diarrhea, constipation, or feeling that the bowel does not empty all the way, abdominal pain, aches or cramps that don't go away, losing weight and you don't know why. If you have any of these symptoms, talk to your doctor. They may be caused by something other than cancer. The only way to know what is causing them is to see your doctor. Factors that may increase your risk of colon cancer. The exact cause of colorectal cancer is not known, but certain risk factors are strongly linked to the disease, including diet, tobacco smoking, older age, a sedentary lifestyle, inflammatory intestinal conditions, and heavy alcohol use. Also, people with certain hereditary cancer syndromes or a family history of colorectal cancer have a high risk of developing the disease. Lifestyle changes to reduce your risk of colon cancer. Eat lots of vegetables, fruits, and whole grains. Diets that include lots of vegetables, fruits, and whole grains have been linked with a decreased risk of colon or rectal cancer. Also, eat less red meat, beef, pork, or lamb, and processed meats like hot dog and some luncheon meats, which have been linked with an increased risk of colorectal cancer. Get regular exercise. If you are not physically active, you may have a greater chance of developing colorectal cancer. Being more active may help reduce your risk. Drink only moderately, if at all. Alcohol is a strange thing when it comes to health. It's heart healthy in moderation, but can increase the risk of colon and other cancers at even low levels. So what does this mean? If you drink moderately, up to 1 drink per day for women, 2 per day for men, there's likely no reason for you to stop. If you don't drink though, there's no reason for you to start. Heavy drinkers should try to cut down or quit. Don't smoke. Long-term smokers are more likely than non-smokers to develop and die from colon or rectal cancer. Get enough calcium and vitamin D. There is good evidence that getting enough calcium and vitamin D can help protect against colon cancer. Shoot for 1,000 to 1,200 milligrams per day of calcium and about 1,000 international units per day of vitamin D. Some groups recommend testing for vitamin D deficiency, especially in those with increased risk of low levels, such as those living in northern parts of the country, as well as elderly people, very overweight people, and people with darker skin. Colon cancer treatment. Which treatments are more likely to help you depends on your particular situation, including the location of your cancer, its stage, and your other health concerns. Treatment for colon cancer usually involves surgery to remove the cancer. Other treatments such as radiation therapy and chemotherapy might also be recommended. What foods are good for colon cancer patients? Clear liquid diet. After a colectomy, your bowels need time to heal and start working again. Immediately following surgery, your doctor will most likely recommend a clear liquid diet because clear liquids take very little to digest. Some options for a clear liquid diet are fruit juices, clear broth soups, tea, and frozen ice. Full liquids. Your doctor will assess your progress and eventually move you to a full liquid diet. In addition to the food allowed on a clear liquid diet, you can also add milk, vegetable juice, smooth soups, and yogurt. If you're concerned about getting proper nutrition, consult a specialist on how to get enough protein, fat, carbohydrates, and calories. When done properly, it is possible to have a healthy diet. Soft foods. Once your bowels are back to normal, your doctor will reintroduce soft foods to your diet. Bread, tender vegetables, cheese, oatmeal, and tender meat will be allowed in your diet. Your physician will give you specific guidelines and portion size and frequency of your meals so you don't harm your bowels. GG yogurt. Grab 1 container of plain non-fat Greek yogurt, 4 to 6 ginger snap cookies, 1/2 banana sliced if desired. The direction is to top your yogurt with crushed cookies and sliced banana and serve. The combination of non-fat Greek yogurt and ginger-containing cookies may help patients consume a light meal or snack, which will help to manage nausea, not exacerbate it by eating a large or heavy meal. Add the banana on top for more soluble fiber if you're also experiencing diarrhea. Should I take supplements? You should be able to get all the vitamins and minerals you need from a healthy, balanced diet. But you may need supplements if there are some foods you can't eat, if you follow a vegan or other restricted diet, or if you have poor appetite. Does having cancer make you lose your hair? Hair loss or thinning is listed as a side effect for colon cancer chemotherapy, but it's most likely to only occur for those on radiation or irinotecan. You may end up looking like Yul Brynner, but it's not as likely as other problems you may encounter. Is colon cancer more common in males or females? Colorectal cancer is more common in men. Men and women are equally at risk for colon cancer, but men are most likely to get rectal cancer. Polyps. These growths on the inner wall of the colon or rectum aren't cancer, but they can lead to it. Colon cancer in patients under 25 years old, a different disease? According to Hayes and Jordan's study on April 2020, younger people have more T2 lesions, 5 times peritoneal metastasis, 4 to 6 times more likely to die of CRC, few with congenital colon syndrome, 10% overall survival for all stages. For the older age group, they have more T1 lesions, less peritoneal metastasis, 3 to 4 times longer survival of CRC, many with congenital colon syndromes, 65% overall survival of all stages. Can colon cancer affect kids? Colon cancer is not common in childhood, even though cases have been reported in children and adolescents. Even though it's sporadic, it can arise in the setting of predisposing illnesses such as familial polyposis syndrome or inflammatory bowel disease. Only 1 to 2 cases per million children are reported globally each year, but the incidence has been noted to be on the rise. The nonspecific gastrointestinal symptoms and anemia as features of the disease could also be seen in other common childhood ailments, such as helminthiasis in the region of West Africa. As a result, unless there is a high index of suspicion at the outset, there is a risk that colon cancer will be diagnosed at a late stage, especially in children with no apparent predisposing factor. Can keto cause colon cancer? There's been a lot of talk about the link between sugar and cancer. For example, sugar is the main food for cancer. All cells need glucose or sugar to survive, including cancer cells. With this information, it could be easy to suggest that removing sugar in the form of carbohydrates could starve cancer, thus putting an end to its existence. Can colon cancer cause sexual dysfunction? Sexual function is affected by colon cancer. Patients' sexual satisfaction decreases significantly, as does the frequency of sexual intercourse. There is an increase in sexual problems like desire, excitement, or pleasure disorders. Male gender, advanced age, distress, and the comorbidities increase sexual disorders. Can colon cancer be caused by stress? Research has long supported a connection between inflammation and cancer, but what scientists are now learning is the implication inflammation may have on the relationship between psychological stress and cancer. So far, research has stopped short of concluding that chronic stress causes cancer, but enough is understood about the association to suggest that being in a constant state of stress is a risk factor for cancer and its progression, and that inflammation is likely to blame. Chronic stress creates something of a perfect storm where precancerous cells can grow and flourish, says Angkor Parik, DO, medical doctor of precision medicine at the Cancer Treatment Center of America.